In today's episode, we explore critical safety concerns in MDMA's promising PTSD treatments.
MDMA for the treatment of PTSD. I mean, more than 60%, successful, in air quotes, plus some people just go into total remission. But the hazards are there. And if there aren't safeguards in place for the practitioner-patient relationship, which is one of the major concerns, if those aren't there, well, then it's never going to be legalized. So
what is the hazard to the participant with the person that's helping them?
So there were two major issues plus some others, but the ones that I'm most aware of is that lack of an adequate control group. People don't know if they got the drug or they didn't. And then the other one is during the course of the trials, there were some issues that came up about improprieties between practitioners and patients.
Like sexual stuff?
There were. My understanding is that there were certain things may have arisen that kind of like pricked up people's ears. But the major issue was this. Is a person who's under the influence of MDMA in a position to advocate for what they need during the course of the session, right? Like, are they in a quote-unquote truly safe space? But the same thing could be said of psilocybin trials. So the solution there, is my understanding, is that you have two therapists there. It's not one therapist, one patient. You have two therapists.
Right.
That there are safeguards in place.
Right.
The same way that, when a brain surgeon does a brain surgery, there's an anesthesiologist there and multiple nurses and staff to get things and hemostats and,
Right.
So I think that there needs to be, a next phase evolution of the way that we think about things like MDMA-assisted treatment for PTSD, because I do think by my read of the data, and I've looked closely at these data, despite a few retractions, there's still a body of data that really point to how powerfully helpful it can be for certain people under the right conditions.
Yeah.
It's just striking.
And there's a tremendous amount of anecdotal data.